Guys, we have a lot of patients that come to us complaining of enlarged holes in their ears. This is a result of wearing an earring, usually a heavy earring, for a period of time, maybe for years. And sometimes you just get an enlarged hole, and sometimes the ear rips through and through. So we do the earlobe repair so that patients can go back and put on their earrings normally. Here, what we did was we did a through and through repair. So we actually made an incision all the way through, cut the two earlobes, the two sides, and then we sewed it back up from front and back. The picture here is at suture removal. So she's gonna wait another few weeks, and then she's gonna repierce her ear brand new in the center of her ear wherever she wants it. This is a procedure that takes roughly about half an hour to 45 minutes to do. It's done all under local anesthesia. It's very simple. There's really no pain involved during recovery. So if you're suffering from an enlarged hole for your earring, or if your earring is not sitting on your ear, there's an easy surgical solution to solve the problem. Omra.